Guilherme, we look forward to hearing about the work you're doing in Sao Paulo.
Okay. Can you hear me?
Yes, we can hear you.
Yeah, you can. Okay, thank you very much. Well, I'd like to thank you, Bill, and also thank you, Ashok, for the invitation for this seminar. I am very honored to be here and very honored to meet all of you folks. I'd like to thank also the organization, this remote, faraway organization of this conference, which is very difficult, especially for me here, who has the best pronunciation of my name I ever heard abroad. So I'm very happy to hear my name quite correctly pronounced. What I want to do here in this less than 5 minutes is present to you a short summary, a short history of what have been done so far and the perspectives in this joint initiative from us in Brazil, in my institution, Santa Casa de São Paulo School of Medical Sciences, and VBP. So the next slide, please. So I will divide this presentation in the past. That means what we've been doing since 2015, to be precise, the present ideas and developments, and some suggestions, some conclusions for the future. So the next slide. Yes, as Bill mentioned, our first contact was in October 15 in the Chilean conference, the 17th Chilean conference, when Bill boldly invited us in Brazil to have this conference at the city of São Paulo. And we had just 1 year to prepare this conference. We worked a lot, but it was finally a very successful conference with more than 300 delegates. And this is very important because I could say that we have begun the relationship between my part and VBP have begun by the most difficult step. We have begun by the Champions League. And after that, we have very high standards to follow. After this, the next step was in the next places. A seminar that was held in November 18 at St. Catherine's College, which was the first step for trying to develop, was a small seminar, trying to develop in the field of addiction services and policies, try to tighten our relationship and develop an addiction services framed by values-based categories. This was a very successful event, and from this event, we have tried during the year of 2019, which is the next slide, please, developed some projects which we submitted. Unfortunately, this submission was, there are some submissions, not two, but there was more than this, were not successful. But the projects are so far waiting for new submissions. The projects, I think, are very good. One of them was with Anna Bergqvist, who was with us here in this seminar. So the next one, please. We made, as Bill mentioned, a translation to Portuguese. Actually, there are now 2 manuals translated to Portuguese. And I forgot to mention, but IMB also published 2 papers, one of them in 17, and the second one, no, up, please. Yes, this is the translation. Upwards, please. Okay. The translation is the other one. I'm sorry for that. This is the conference where, and we held a conference this year. This is a conference between Manchester Metropolitan University and our institution here, under the activity of the network of VBP, which was held, as you may note, 3 days before Brazilians lockdown for COVID. So unfortunately, I wasn't able to be in presence in Manchester for also many familiar reasons, but this conference has happened. And I think in this occasion, we launched some ideas and some opportunities for new developments. The next one, please. Presently, our main project, Bill is here and can also say, is a program, a master level, a very creative new program, bringing together people from many countries of the world to kind of make what we called Meta Masters program, a Masters from Masters, a remote distance program, which we will launch next year between England, UK, and our program here in São Paulo. I think this is so far the most challenge and the most ambitious initiative in this 4-year relationship. We have also a paper, I and you have a paper in press presenting the idea of a phenomenological values-based approach to addiction, substance misuse problems. The next one, please. Well, future. I mean, if we are engaged in the idea of developing VBP strategies in Brazil, and I do want to, we should pay attention to the following threads, to the following characteristics of Brazilian context, which may be very fruitful to developing these ideas. These are 3. The first one, please, here. The first, yes. Well, as Colin mentioned, it's only the one now. Well, anyway, you have the 3. You have also the end of the movie. No problems. The first of them, racial and gender issues. What do you think about a country which, in the beginning of the 18th century, there were more enslaved persons than free people? So this is the history of Brazil. It's impossible to understand a modern Brazil without this very, very hot topic, which is racial problems in Brazil. And I think we can tackle this challenge here in the joint efforts with VBP. The second one, successful thread to follow, would be working on the improvement of effectiveness in general medical practice. I and Bill are now working on this. So I think this is all, and I thank you very much for your attention.